Boy, new technology at Baton Rouge General Hospital making patient intake and record recovery a little easier and more accessible.
Officials say it's becoming their preferred method of checking in and allows them to better serve their patients. Jaron Jordan is live outside of BR General this morning with details.
Yeah, good morning to you, Lauren. This is the type of technology similar to how some phones allow you to use your fingerprint to unlock them. Well, instead of using a fingerprint, what's happening here at Baton Rouge General, you're actually able to use your palm vein pattern. Now, the technology has been in place here for about a couple of months now, about 6 months, and already about 50% of patients are registered to this database. How it works is that your individual palm vein pattern is linked to your medical record. So when you show up to the hospital or one of the clinics within the Baton Rouge General system, all it takes is about 3 seconds to scan your palm on that palm vein scanner, and nurses and doctors can quickly access all of your medical records, all of the information. They can see if you're on any medications or anything like that. Doctors call it, they say that it is a very quick and safe method. Now, this is an optional database. No, you're not required to partake in this, but they do call it their preferred method here at Baton Rouge General. We talked with Bennett Jeremy to find out why they wanted to take a part in this new technology.
Be able to identify our patients and link to their medical records quickly when they come into the hospital. Sometimes our patients come into the hospital and we can't get their names right away. So by getting their vein palm scan, we can link all of their medical records on the front end when they come into the hospital, and we have access to all that information when we're treating them, instead of a couple of days later when they can talk to us and find out exactly who they are.
Now, some people may be a little bit skeptical, seeing as though this is another database that's kind of storing some information and protected by your palm vein. Doctors and officials do say that palm vein scanning is one of the safest methods in biometrics. We're going to talk. We talked to Bennett Jeremy about the safety precautions that they're taking here at Baton Rouge General. We're going to tell you about that coming up in the next half hour. Matt and Lauren, let's send it back in.
Baton Rouge General Hospital is the first system in the metro area to start using palm vein scanning for patient intake and record recovery. Officials say it's becoming their preferred method. Jaron Jordan is live this morning with a look at this new technology. Sounds pretty cool, Jaron.
It is pretty cool, Lauren. It's kind of like the same technology that allows you to open up your iPhone or Android with your fingerprint, but officials and doctors here at Baton Rouge General say that this is a method that's even safer than that, and that involves using your palm vein pattern. Now, officials here rolled it out a few months ago, but just now they've gotten over 50% of their patients all registered into this database. The way that it works is that if you want to be a part of this database, if you're a patient in the Baton Rouge General system, then you can register for that database. You register your unique palm vein pattern, and whenever you come to the hospital or whenever you go to a clinic within the Baton Rouge General system, all it takes is about 3 seconds to scan your palm vein pattern, and all of your medical records, all your medical history, the doctors and nurses can see if you're on any medications. All of that comes up within that 3-second scan. We talked with Bennett Jeremy, who's the Vice President of Information Systems through the Baton Rouge General system, just to find out how safe and secure this palm vein scanning is.
And we don't share that data with everyone, but instead we use our electronic medical record. We send it one file to sort of get that information over to it. It's not a free-flowing back and forth. Secure transactions through multi-layered encryption. So palm vein scanning is one of the more secure technologies you can use when it comes to biometrics.
And something else that's just kind of neat about this technology is the fact that it is used throughout the Baton Rouge General system. So whether you're here at a hospital or at a clinic for your routine doctor's appointment, all it takes is that scan if you are in that database, and all of your information can come up. So again, they say that it's very safe and secure, and it's definitely helping them quickly access patient information in those critical seconds when they need it. Matt?
New technology at Baton Rouge General Hospital is making patient intake and record recovery a little easier, more accessible.
Officials say it's becoming actually their preferred method of checking folks in. Kind of allows them to better serve patients. Jaron Jordan live outside of Baton Rouge General this morning with the details of exactly what it is. It's all about the palm. Morning, Jaron.
It is all about the palm, Matt. Good morning to you. Now, we already know that there is technology similar to palm vein. It's like the technology that allows you to kind of unlock your phones, your iPhones, or your Androids with just your fingerprint. Well, this technology, as you mentioned, all about the palms, it is palm vein scanning. Now, what this does, it allows patients who are in the database at Baton Rouge General Hospital to have their palm vein patterns, their unique palm vein patterns, linked to their medical records. This has been rolled out for the past 6 months, but just now Baton Rouge General has reached about 50% of patients registered for this technology. It is optional, but as you mentioned again, this is becoming the hospital's preferred method of checking in. It's not just at the hospital, but it is system-wide, so people who are in the database can show up for doctor's appointments at their clinics, and it takes about 3 seconds. That palm is scanned upon check-in, and the result of that is basically the doctors and nurses can pull up your complete medical records, see if you're on any medications or anything like that. The hospital says that this is a way to quickly and safely access patient records.
To identify our patients and link to their medical records quickly when they come into the hospital. Sometimes our patients come into the hospital and we can't get their names right away. So by getting their vein palm scanned, we can link all of their medical records on the front end when they come into the hospital, and we have access to all that information when we treat them, instead of a couple of days later when they can talk to us and find out exactly who they are.
And palm vein scanning, they say, is one of the safest and securest methods in biometrics. Coming up in the next half hour, we'll talk about the safety and security that is around that. Again, Baton Rouge General Hospital, the only system right now in the metro area that's using this technology. They do say that it is definitely helping their processes and being able to serve their patients quickly and efficiently. Matt and Lauren.
Baton Rouge General Hospital is the first system in the metro area to start using palm vein scanning. This is for patient intake and record recovery. Officials say it's becoming their preferred method. Jaron Jordan looked into it. He is live this morning outside the hospital with a look at that new technology. Hey, Jaron.
Hey, Lauren, yeah, that's right. This is the palm vein pattern technology. It's similar to some technology that allows you to use your fingerprint to unlock your cell phones. Well, doctors and officials here at Baton Rouge General say that the palm vein pattern technology is even safer than that. They've been rolling it out here for the past couple of months, and just now they've gotten over 50% of patients registered into a database. This is how it works. Basically, if you want to be a part of this, it is 100% voluntary. You register your unique palm vein pattern, and what that does is link your print basically to your medical records. So when you come to the hospital here, or if you visit a clinic within the Baton Rouge General system, all it takes is about a 3-second scan, and doctors and nurses can immediately access all of your information, your medical records. They can see if you're on any medications or anything like that. We did mention that it is 100% voluntary, but officials here say that it is becoming their primary or their preferred method of checking in. Doctors can again quickly access everything that they usually they typically ask you. Bennett Sheremy, he is the Vice President for Information Technology. He says that this is one of the safest and securest methods, so patients shouldn't be concerned about that. Take a listen.
And we don't share that data with everyone, but instead we use our electronic medical records. We send it one file to sort of get that information over to it. It's not a free-flowing back and forth. Secure transactions through multi-layered encryption. So palm vein scanning is one of the more secure technologies you can use when it comes to biometrics.
And again, a really neat feature of this is that it can be used at the clinics as well within the Baton Rouge General system. So even if you're just showing up, whether you're showing up here to the hospital for an emergency, or if you're showing up for a routine doctor's appointment at your family practice, those scanning terminals are at every check-in place. And if you are in the registered database, then they can have all your information within a few seconds. And again, they say it is safe and secure in assisting them with their check-in process. Matt.